special place that understands your life. We are Memorial for Women.
If you or a loved one is experiencing depression, anxiety, or bipolar disorder, there is help locally. Bridgeway Psychiatric Center offers a day treatment program that combines medication management with psychotherapy to decrease symptoms and help clients get back to the things they enjoy. If these symptoms describe you or someone you know, Bridgeway can help. Bridgeway Psychiatric Center provides effective treatment without the confinement of a hospital. For more information or to schedule a confidential screening, call 562-0211.
My daughter has a cousin. She pulled out all her eyelashes and her eyebrows and her hair.
Do you know why she did this?
Nerves, just nerves, and stress.
It's a disorder that a lot of people don't understand. Do you agree?
Well, I can understand it when your nerves start bothering. I pulled my hair out. My hair used to be down here. I've been pulling my hair and cutting it and doing everything. Look at it. I was gonna actually color my hair teal and put purple in it after the hurricane.
Welcome back. My next guest, Christina Pearson, is the founder of the Trichotillomania Learning Center. Her foundation and its website provide a fantastic resource for understanding more about this disease. Please welcome Christina Pearson. Hi, Christina.
Hi, Dr. D.
How are you?
It's really wonderful to be here.
Well, it's fantastic that you're joining us from way out in California, right?
That's correct, Santa Cruz.
Santa Cruz. How's the weather out there? I'm sure it's better than it is over here.
Well, right now we have a marine layer, so it's pretty cool. A lot of fog. Sun will come out later.
Okay. So, Christina, you have founded this organization. I want to talk about your history first. Tell us about your own situation with trichotillomania, when it started, when you first knew that it was a problem.
When I was a child of 12 and 13, I began to pull my hair. It started at 12, at 13 it got very, very bad. By the end of my 13th year, I was completely bald from the tops of my ears to the crown of my head, and it was very, very frightening. When my mom took me to a doctor, they had no idea what I was doing. This was back in maybe 1969.
Okay.
So
it started back in 1969. You went to doctors, and let me guess, nobody knew what it was. They couldn't give you a diagnosis.
Boy, spot on, doctor. Spot on.
Unfortunately, that's a common problem with this condition, and amazingly enough, it's common even today. So you had the problem. No one could tell you what it was. What were your high school years like?
Actually, I didn't go to high school. I got a psychiatric discharge because I pulled out my hair. They didn't know really what to do with me. So it was a very difficult time. I actually didn't find out exactly what I had till I was 33 years old. So I spent 20 years not knowing why or what I was doing.
And what were you thinking during that time? Were you thinking that, hey, this is who I am, this is never going to go away, I'm just doomed to have to live like this for the rest of my life?
I knew I was smart. I was a brilliant student, and yet I could do just about anything I set my hand to, but I could not stop this. So I felt really defective.
I know, that's an incredible situation for people that have so much self-control, that are smart in every other area, and they can't understand, why in the world can I not control this? I don't get it. And I think that adds as much to the condition as the actual problem itself.
Again, you're spot on, doctor. That is so true, because it's such a dichotomy in one's awareness that you can do so much and yet you cannot control this behavior. And there was a time when I felt that my hands were my own enemies and I wanted to cut them off. Luckily, at the age of 33, I get treatment, and I found out the name of what it was I was doing. And that was at Stanford Medical Center with Dr. Lauren Curran. The issue was that there was no resources for people like me. There were no treatment. There was really no effective treatment. There was very little awareness. There was nowhere to send people, no information base. So that's why I decided to set up this center.
So now, obviously, we do have medications. We do have treatments that work for the condition. Are you being treated now with medication?
I've actually been on Prozac for about 19 years, and actually I'm not on it for my hair pulling, but for my depression. My hair pulling has basically been managed through cognitive behavioral therapy and a lot of self-awareness training.
That's
My depression, which got in the way of being motivated to do the behavioral work, is treated by the Prozac, and I'm really grateful for that.
Well, obviously, a lot of times with this condition, you do have depression because it's depressing to be able to have something that you cannot control and that you continually to do repetitively. So, I mean, I think it's fantastic that you've used therapy to get better. There's a lot of different treatments out there in terms of meds and therapy. Tell us about your organization. What do you guys focus on? Is it mainly education?
The Trichotillomania Learning Center is a national advocacy organization. We train doctors in effective treatment, empirically based treatment, cognitive behavioral treatment. We also teach about medication usage. We do annual retreats. We do conferences, national conferences. We do one-day workshops. We have a huge amount of educational literature that we're developing. We have online listservs. The list just goes on and on and on. From little, we work with people with toddlers to 85-year-olds.
That's, Christina, that's fantastic. We have to go to a break now. We're going to have you back after the break. We're going to talk a little bit more about this. So hang in there on your Skype, and we'll be right back.
If you or a loved one is experiencing depression, anxiety, or bipolar disorder, there is help locally. Bridgeway Psychiatric Center offers a day treatment program that combines medication management with psychotherapy to decrease symptoms and help clients get back to the things they enjoy. If these symptoms describe you or someone you know, Bridgeway can help. Bridgeway Psychiatric Center provides effective treatment without the confinement of a hospital. For more information or to schedule a confidential screening, call 562-0211.
At Memorial, we get that women are different and that you have special needs and wants, like modern birthing suites, the latest breast health diagnostics, advanced neonatal care, and other women-specific services. As a mother, daughter, sister, wife, and grandmother, you have many roles in life, and so should your health care. That's why there's Lake Charles Memorial Hospital for Women, a special place that understands your life. We are Memorial for Women.
Have you gone from being someone who was productive and happy, who enjoyed life and time spent with friends, to a person alone and confused? You can turn it around like others who have gotten help.
Have you or a loved one become addicted to pain pills or other opiates? If so, Behavioral Health Group's Lake Charles Substance Abuse Clinic can help. Please call 337-433-8281 to schedule a confidential appointment.
Welcome back. I'm Dr. Dale Archer, and we're talking trichotillomania with my two guests, Christina Pearson and Catherine Ozan. Catherine, I would like to know if you have any closing thoughts about what the most important thing that you want the public to know about this condition.
That you can get help. The help is out there. It is available to you. And most importantly, medication, it does work.
Okay. And Christina, what about you? Any closing thoughts about the most important thing for the public to know?
Absolutely. I'll back up what Catherine said. There is help. There is effective treatment. You are not alone. Please go to Trichotillomania Learning Center's website at www.trich.org.
Okay.
And there's lots of resources there.
Fantastic. We'll put that up on the screen so that they can see that. I want to thank you all for joining me today. That's all the time we have. And I want to tell you that you can visit my website, www.telldrd.com, TELLDRD.com. Submit a question, or if you want to be a guest, please send me an email. Next week, we're going to be back with another great show on single mommyhood. Please join me. Thanks for watching. Goodbye.